You're listening to Health Professional Radio. This is the Health Academy, our regular look at what's happening inside academic services in the health industry generally. My guest today is Dr. Atieh Sadr, who is from the School of Dentistry. Welcome, Atieh, to Health Professional Radio.
Thanks so much. Thanks for inviting me.
It's my pleasure. Now, you've got an interesting background and also an interesting research agenda. First of all, you're from Sturt University. Tell us a little bit about that facility.
Yep. That was a very good one because I wanted to explain a bit about here that I'm working at the moment. Sturt University, the dental school in the Sturt University is, I can say it's a bit new dental school. Although it's around 8-9 years old, and we had the second graduation last year. We're going to have the third one this year. And it's the 5-year course that the students are going to pass the 5-year course to get the Bachelor of Dentistry from CSU. Usually the campuses in the Orange area, the main building, that they do most of the teaching part of it. But there is the different campuses. CSU have the different campuses in the different area, the regional area, and that's in Wagga, in Albury, in Double, and in Bathurst. And usually a student will go to different clinics in their 4th year and 5th year, and mostly in their 5th year for the placement, and they go there and then see the different patients. If I say that's the great facility, if I compare it with Sydney and the other school as well, that's very new. And then we have the lecturer that coming here from the different university. That's very nice facility, very new one. And our students are very lucky to have all of this facility here and get to use them as well. Yes. And
Atieh, have you been at that facility for long?
It's about 5 years. So I had the background of the teaching in my country, Iran, and for the 9-10 years, and I have done the teaching for 9-10 years. Then I came here to ANU, to Canberra, to do some research, so in SEM. So I have done 1 year, I have been there, and then after that I came back and then joined my husband, because my husband started to work here as a general practitioner. So I joined him, and then after that I started working as dentist, and then joined CSU. And it's about just 2010 that I joined CSU to go back to my teaching. I love teaching, so I wanted to go back to teaching. So I applied for that and started teaching again. That's it, yes.
Yes, academic teaching is one of those things you either love or hate. So
that's it, yes, yeah, yes. It's very important, yes.
So, Atieh, I guess it's been a huge shift in academic culture from Iran to Australia.
What do you mean by that? That's different about the kind of the work that you do. Maybe just, for each country when you enter, some of the policies is different. There is some guidelines that is different. But the main work of the practical work of it and how much you work in that area, that's something that for me wasn't new. That's just because I have worked in that area, especially in endodontics as well. But there is some of the material change or just the equipment change. And when you work with some years after that, 1-2 years, you get familiar with all of these things. To get familiar with the guideline and also the policies and everything. So yes, yeah.
Pedagogically, is it a different way of teaching, or is it very similar?
Yeah, but when I say about pedagogically, it's not so much different. If I can say, I go back, for example, when I started teaching in my country in 2008-9, maybe I can say the generation of the student that I had was completely different that we have now. And when I talk with my colleagues in my country now as well, they said that yes, because there is completely change of the generation. We have the different generation of the student now. The things that is different here, for example, when I see there is most of the thing, because in CSU for me as well, maybe it's not in the other university like Sydney, because this university is mostly distance learning, they are just working mostly on just the online things. Mm-hmm. So there is so many things that should be online, their subject outlined before the start of the session and everything. So there is some change regarding that one to get familiar with these things. But because all of the pedagogies change as well with the new generation, when I came here, yes, I wanted to get familiar with these things. It's not because I think mostly because of the area of the change or just changing of the country, because all of these concepts change as well. I feel like this. And you should just make you refresh in that area to get just be a good teacher, I think. Yes, that's the thing, I think. That's the main thing. Yeah.
And your particular area of interest pedagogically is, I see in your bio, a focus on active learning. Yeah. How does that translate into practice?
Active learning. When you just, at the moment we just see a generation of the students that, when I look at my son, it's completely different when it's just in 2008 completely. They are just more computer savvy. They wanted to do themselves. They wanted to try the things themselves as well. So about the active learning, we give them, for example, resources learning. So or we can say just dentistry, you should go back to the evidence, and because there is so many of the treatment for a patient as well, but you should find the best evidence regarding that. So on the base of that one, we give the resources, we introduce something, we just bring that forward to the students, and then a student, they're going to find it, and on the base of we call it just active learning, so they can search it and then we can discuss it. So we are like just the facilitator in the class. We just bring something to the class and just show them. And then by discussion, bring another word to them so they can discuss. We can discuss the cases. We see the different cases, how they diagnose a patient, and then what's the options of the treatment for a patient. And they discuss it and they find the best way or the best treatment for the patient. So for the treatment for the patient, for the dentistry, I think that's the best way of the learning, and because that's the problem-based learning, that's the best way for the student to find a way, and then yes, they can treat the patient, and that's the way in the clinic as well, because they should find in just a short time what's the option for the patient, discuss it with the patient, and then find the best way, and then start treatment after the diagnosis. Yes.
Now, Atieh, what is your current research interest?
Because my background, mostly because I have degree in just dentistry and also a specialty in endodontics, in root canal therapy. Recently, with just a senior student, I'm working on mostly gathering the newest thing that I'm working with the student now. And I wanted to find some connection, because I'm working in the regional, just the university and dental school, to find the success failure factors in endodontics. So we're gathering all of the data of the treatment that have done in 5-6 years ago, during the 5-6 years ago. And we want to find out what's the factors for the success of all of this treatment, and what's the factors of the failure of all of this treatment. But the newest one that I'm working with the student, and also in clinic myself, in the private clinic that I'm working in the moment, it's related to regenerative endodontic therapy, and that's a very new term. Mm-hmm. I think that just the concept of that one, it goes back to just a bit of the tissue engineering. That tissue engineering is very new in medicine as well. Yes. A stem cell, that's a big thing now in medicine, and it's a big thing in dentistry. That's very newer compared, I think, to the medicine as well. But it's the main concept of that one is I'm working with the young, the patient that I'm seeing. It's for the patient that had the trauma for the front tooth. Usually for the young patient, I can't show you just on review now, but the thing is usually the shape of the root of this patient, the root is not the conical, the end of it is not the conical shape, yep, like the adult patient. It's a bit open, the end of them. And we call it the open apex roots. And in this kind of the patient, we can do the normal kind of the treatment or root canal treatment that we do with the adult patient. we can't clean easily and we can feel it because the end of it is completely open. So there is some old kind of the treatment, and we put some material, we try to make a bridge at the end and then do the cleaning and the filling inside the root. Mm-hmm. But this new kind of the treatment is like we're trying not to just do the normal treatment. What we do, we try to activate or bring some kind of, we try to clean it, and then with some kind of a special treatment, we bring some cells inside, and the aim is just the root develop. We make them just activate the development of the root. So we wanted to make, just by passing the time, by doing this act and put in a special material in the upper part of the root, trying to bring the life back to the root. So because the normal, just the young root usually has very thin wall, and it hasn't developed completely, but this kind of the regenerative prone to fracture later as well. So we are not doing any just the normal, just the root canal therapy cleaning and the filling. We don't fill inside the root. We just activate inside the root, so make it just to develop completely. It's very new to the field, but at the moment we are at the stage of gathering all of the cases, and at the moment, the American Association of Endodontics gathering all of the cases from the different kind of data, and then they're looking for just the best guideline for such a treatment. But there is more of this case report coming in the journals, in the scientific journals, and I see more and more in these cases. We do it. I'm doing now with the students. So a student in the clinic, the senior student, under my supervision, they can do it. It's a very just delicate job because it should be done under the microscope. So we have the microscope. Unfortunately, we have that one. So we do it with the student clinic, and also in my private clinic as well. I just give the option to the patient, and then they can choose to go to this one because it's less aggressive compared to the other type of the treatment as well. Yes.
Well, I guess I say this a lot to academics because the nature of research is it is always new. But I had no idea that sort of stem cell work was being carried out. That's very interesting.
Yeah, that's very new as well. At the moment, and I think in future, at the moment we're trying, although it's not exactly, we're trying with that bringing because we're trying to make the bleeding but bring the blood inside the root, we're trying to bring some of the stem cells from the end of the root inside. Mm. I think in future with this tissue engineering, later as well, we can, if there was easy as well with tissue engineering, they gather all of the stem cells. And there is some areas from the wisdom tooth of the patient. They can gather all of the stem cells specifically for each patient, and then later they can use it in the different area. And one of the areas is like this, in young tooth, when there is a trauma happen on the front one, mm-hmm. and they can use it specifically for each patient. So in future there is just a big area. Yes, I think it's a big area of research, and it's very challenging. It was a very good one, I think. Yeah.
Atieh, an exciting area of research to be involved in, and can I say thank you for sharing your story with us today and the story of your research. We wish you well with that, and I think you're probably at a point where we can wish your patients well too, because it sounds like they're getting the best of treatment for those particular trauma cases.
Thanks so much. Thanks for inviting me, and that's good that we can talk with your audience and they know about all of these things. Yeah. Thanks for that.
It's been a pleasure chatting, and we'll do it again soon, I'm sure. Thank you for your time.
Thanks so much. You're welcome. Thanks.
You've been listening to the Health Academy on Health Professional Radio. This is Wayne Buckler.